just look at the point which we call as the most crucial point and command point of the urinary bladder meridian, called as a Weizhong. Weizhong means UB40. So when you look at the most of the diseases, now I told you the lower back pain and so many back pains are existing. Among them, the one distal point, there are the 6 distal points in our body. Among them, the one distal point which we call as a Weizhong, that is UB40, that point is located on the transverse process of the popliteal fossa. When we look at on the back, back of the knee, you can find the diamond shaped depression. In that depression, the point is located, that point is UB40. When we wanted to treat any kind of the back pain, so that to be even for the upper back pain is the distal point is UB60, and then middle back pain the distal point is UB60, and lower back pain the distal point is UB40. So in fact this point is really amazing. In the instant the patient need to get relief, you need not to apply the local points. Without using local point, by home itself you can treat the most of the back pains in the general pains which we called as a UB40. So in fact I got the tremendous results with the people. So really who are suffering for the back pain, most of the patients got relief by activating this point which we called as a UB40. When we look at that particular position, the patients will pop up the veins which we called as a blue veins. That blue veins we called as the engorged veins. Engorged means is the distension of the veins, a swelling of the veins. So once you just open that veins of vicinity of that UB40 area, that around that area you just puncture the veins, so certainly that veins are coming out the blood. So around the 10 cc of the blood and 10 ml of the blood you can withdraw by doing the needling or by take the lancet. Through the lancet you puncture on that particular region to withdraw the maximum amount of the blood. So in fact this blood is, how to understand this, the toxic blood or the good blood. So when we look at the brownish, blackish and purplish blood, so dark blood to be considered as a toxic blood, and whereas in the bright red blood to be considered as a normal blood. When we look at that, the blood is coming out is the purplish and darkish brownish blood. Till that it come out, you just allow the blood come out easily. So when the blood is slowly coming out, then it's not coming again, then again you just use the swab with cotton. So with the spirit you just apply that particular area, again the blood is started coming. So till how much percentage wanted to come, so minimum 10 drops to maximum 10 ml of the blood you can withdraw by activating that Weizhong point. So once you withdraw, the toxinated blood is coming out from that, and certainly that is a good remedy for the back pain. So when we look at that, if there are the some popliteal vein or the tibial nerve, get the compression of that particular region, it forms kind of the cyst, that cyst called as a popliteal cyst. That cyst, the another name which we call as is the Baker's cyst, B-A-K-E-R-S, Baker's cyst. So if that cyst also is there, even that condition also you can do the puncturing on the vicinity of that area. At the same time you just use the, if there is the Baker's cyst is causing the back pain, even that condition certainly you can do the fire needling to that particular point to dissolve that cyst to get the relief of the knee arthritis. Sometimes is the osteoarthritis of the knee. The people who could not able to touch the earth by doing the straight leg, they cannot keep it and touching to the earth, even that condition also can be treatable. And when the patient is in the prone position, puncture and then do it, the fire needling or the moxibustion also can be done to this particular point. Once you do this drain out, what are the excessive fire is accumulated inside the meridian of the vesical organ, so that you are drudging out or in order to invigorating the chi and blood to that particular meridian. So in order to flow the chi and blood, you are withdrawing the unwanted blood which is accumulated in that meridian pathway. But however, this UB40 is good point to treat for the back pain. At the same time it is the grandmother point for the urinary bladder. At the same time it is the HEC point of the urinary bladder, and also it is the command point, so which we call as a conjunctory point of the urinary bladder. So no doubt when the person is suffering for the knee pain, as per the traditional law, we can say the front can treat back and vice versa. The front side, the patella pain is there, you are treating to the back by activating UB40. So in that way, certainly you can use, the point is located when you puncture the needle 1 chun, it is recommended. When you are puncturing to the deeper level 1.5 chun, 2 chun, it causes the damage to the popliteal artery. Beneath of that particular point, the artery is located. That artery is called as a popliteal artery and a popliteal vein, and also there is a nerve which we call as a tibial nerve, and then cutaneous sural nerve. So therefore we should not puncture the deeper level. Of course is the 1 chun. Even obesity patients, 1 to 1.5 chun incision can be done, the deeper level of that particular point. Right. So at the same time, when you understand this particular point is good point to treat not only for the back pain, you remember this works for the collateral way to activating to the neck pain, cervical pain, and also that called as a spine pain and buttocks pain and back pain. Of course this, in this way there are the numerous ways certainly we can activate from the neck to the back. Because of UB10 you wanted to treat the knee pain can be treatable. At the same time you are treating to the UB40 can be treatable for the neck pain. There is a connectivity. There is a interior energy pathways which we called as a divergent meridian pathway, communicates from the UB40 and terminates on the UB10 Tianzu. Therefore there is an interlink between the interior meridian pathway. So therefore UB40 you apply, the neck pain can be treatable, vice versa. Or you are adding the both the points UB10 and then UB40, certainly having the good results for the treating for the back pain and the knee pain and also for the cervical pain as well. You understand? So this is in fact this point to be called as a C-cleft point for the blood itself. There is a C-cleft point for the each and every meridian. There is a C-cleft point. For example, lung meridian having the C-cleft point, that's point called as a Kung Sui, that point is LU6. Then another point is large intestine meridian having the C-cleft point, that point to be called as a Wen Leo, that is Li7. Right? The stomach meridian having the C-cleft point, that point to be called as a Lian Chu, that is stomach 34. Sorry, stomach 34, right? So in the similar way, every meridian having the C-cleft point, spleen meridian having the C-cleft point, that point to be called as a Chi, that is spleen 8. So C-cleft point means in order to, for any kind of the acute infections or acute related problem, or there is a retention of the Chi and blood in that particular meridian, we are activating this point. So therefore you remember that anything the C-cleft point diseases can be treatable by activating that particular meridian. Now you remember anything the blood stagnation is there, even that condition, in order to improve the blood overall across the body, which supposed to the heart system, which supposed to the cardiac system, which supposed to the liver system. So therefore this point is the C-cleft point for the blood. The influential point for the blood is Keshu, that is UB17. When there is a C-cleft point for the blood is UB40. So that is the beauty of that. So there is the angry vein which we called as the engorged vein. So that vein get pop up on the popliteal fossa. We need to drain out in order to treat for the back pain. Of course this point is grandmother point. You need not to withdraw the blood. Sometimes when the UB is deficiency, without withdrawing, you just apply the needle towards the energy flow. So that point to be activated in order to regulate the UB meridian. UB meridian energy will be invigorating energy, right? In the similar way, there are the numerous functions of the UB meridian. Certainly this will help you in generally to treat for the back pain. Sometimes you don't have that needling, or you doesn't have the lancet, you cannot bleed this point. Even that condition I can suggest you, sometimes is the ice application to that particular region also gives the immense relief for the back pain as well. Ice packs you just apply, the cold compressions apply in that UB40 region. Or you don't have that, better you can use the moxa also. The moxa, blood lenting, pressure, or there is the kind of the needling. So all these things are applicable to the UB40 in order to get relief of the numerous diseases related to the UB meridian. Hope you understand. When you try to see where that particular anatomically located that point, where the diamond shaped depression is there, in that depression you puncture the needle, give the pressure, certainly the patient will get relief. Or the patient themselves, they can't do this pressure, but we ask them to their attenders to give the pressure to that particular particular region. So ask them to patient, please, you just somebody ask them to give the pressure or moxibustion to this particular region for get rid of the back pain. Certainly this have numerous results related to the back. We don't know the back pain is related to the iliopsoas muscles or the psoas muscles or the lumbarum muscles or the related to the which we call as a gluteal maximus muscles, gluteus medius muscles or the piriformis muscles. So many muscles reason to cause the pain, or there is the vertebrae which we call as a lumbar spondylosis, lumbar listhesis, or there is a kind of the lordosis. So anything related to these conditions, back pain is there. Even without knowing that, you wanted to use as a distal point for the, how the distal point for the chest we use as the pericardium 6 is the niche 1, and then nape distal point is LU7, that is lead 2, right? Then the neck region, the distal point is hook C, that is SI3, right? And also abdominal system, we use the distal point is Susan, Lee, stomach 36. So in the similar way, the UB40 is the back pain related conditions can be treatable by activating the single point, that point to be considered as a UB40, right?